For all your pastry, bakery, and quality food, CK Restaurant is the only place to be. We do catering for birthdays, weddings, and all related services. We have all kinds of local foods, American, European, and even beyond. Come and have a taste of our local juice, ebe, and other services. At CK Restaurant, customer satisfaction is our priority.
Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3, or 4 bedrooms, or our story buildings, 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine. And see that.
diwli lanni maaro lanni
fop lanni
awa joni mi anda honno gerdeten e ngalɗo sabu e ngalɗo Ibrahima jonnal taw joni mi anda se yahay kapitiki ñawloɗen ha humpodiren e makko est ce que non e warude
waɗen non awa
ane ko de Ibrahima ma ko to woni
mo Amérique
ko Amérique a woni kede humpitaki fiɓe musidɓe men baluwo ɓe andanɗa kala ko wawɗa wonde e aduna o si a rewi e juuɗe maɓɓe a jonnay ɗo dépassement o Gambia hara no weeɓi a yahata kadi taw ko mbuɗi ɗi no ƴawi walla no jippi ɓe haalantama ko kala ko falɗa ko sengo ñamete ini nebba maaro basalle pomme de terre kala ko rewi ɗon a hendoto hara no weeɓi kadi wona ɗum ɗon tu ɓe jonnira e mobile phone siko ɗum kadi laptop kala ko wayrode ɗiɓe hay kasbawa ɓe wawma jonnude kadi sa fala humpitade ko weeɓi ƴettu Google account ma joni data ton waɗa download app maɓɓe on ayiyay kala ko humpima e maɓɓe ton ɓe weeɓi ha mat
ka wonɗa wo e aduna on
kala ko wawɗa
a jonnanayi wonɗo ka leydi men Gambia ɗo dépense
hara no weeɓi ha ma si ɗum non fof no neeɓi immoɗen joni mi ɗowtama ka place maɓɓe jano
waɗen joni
iya heɓa ko falaɗa
waɗen kisam.
Good morning to you once again, and let me take this opportunity to introduce the two speakers for this update on COVID-19 vaccination. We have our national coordinator, the name of Mr. Yaya Sanya. Some of you I'm not so, but some of you may know him. He was working for the Minister of Health, and then from there he worked for WHO. In several parts of the world. He's an experienced public health officer. The other man with immediate next to me is Sirat Fofana, is the program manager for expanded program on immunization. So these are the two gentlemen who are going to provide us with the update. We all know that some time ago, early part of this month, we received the first consignment of COVID-19, AstraZeneca for that matter. And most of you witnessed that occasion at the airport. And we must thank you for your participation in sharing that information with the general population. And we continue to thank you because you've been participating in several activities with regards to this COVID-19. So we want to thank you once again. The reason why we are calling this particular meeting is during our meeting on Monday in Banjul, we realized that people are still not very clear about the vaccination activity, ongoing vaccination activity. You could recall that launching was done on the 10th of this month by the President at State House, where most of you also participated. And that was also followed by a press conference at the Minister of Health. And from there, we are now trying to roll out to other parts of the country. But it's still not very clear to people where to get their vaccines, who should take it. So that's the reason why we are calling on you to share some of this information with you. And we expect that from here, this will be disseminated to the general population for people to understand who should get it and where to get it. So these are the two important part of, this will be the two important part of our discussion. So as I said earlier, we have the national coordinator as well as the program manager for expanded program for immunization. And he's also here with some of his colleagues, Mr. Lamin Sise and other members. So thank you very much.
I think the task today is very simple. It's to tell the population the strategies we are using. Who are the targets? Initially, when we started, our intention was to target health workers first. Until we finish with them, then we fall back to the rest of the population. But it was realized that we have vaccine far more than the public health officer, those working in the health sector. So, and then that it will be better for us to also incorporate those with comorbidity. That is for hypertension, those with hypertension, those with diabetes, those with other chronic respiratory conditions, and so on. So that's what we have now adopted. Health workers will be vaccinated. If you have comorbidity, you can prove it that you have comorbidity. When you go to the vaccination centers, they will vaccinate you. If you are 65 and above, it's also a target for vaccination. So these are the people we want to vaccinate so far, but then the rest of the population, during the subsequent phases of the vaccination, they will be covered. The only people that would be covered are those from 18 years and above, unless if they have comorbidity, because we have seen so few cases like that. People less than 18 years with comorbidity. We distributed the vaccines last Monday. The training took place over the weekend of health workers that will do the vaccination for both rounds. So yesterday, they were busy trying to sort out their teams, but as I'm talking to you, a lot of teams have been distributed. They've already started vaccination. If you go to FSTH, Carnifing General Hospital, Lakeside Regional Eye Care Center, Bursubi, Serakunda, Burfoot, Banjulunding Health Center, Bakau Health Center, Faji Kunda, Ahmed Clinic, Gundung, Afrimed. So we have close to 10 vaccination sites or even more today where these people I've mentioned can go and receive their vaccines. So, because initially we have not distributed vaccines and there was a lot of chaos. There are only few, we wanted to only vaccinate those at the treatment center. And then we understand that so many people, old people are living in this country who had comorbidity and they were looking for the vaccines. Despite the negative rumors, the people were looking for the vaccine. We were surprised as to the amount of response we are getting from the population, especially these three categories: comorbidity, those 65 and above, and also our health workers. So that's the situation. So as we go into the week, I know the tensions will cool down, and then people are coming forward, and then that's what we are clamoring for.
Except to plead with the media that we need the correct, simple information out there to the public. People need to know the basic, simple information they need on this vaccination. And I think 3 simple messages we should be able to try to push out to the communities now. One is the vaccination is one of the best tools we have to try to combat this disease. This vaccine is in addition to the basic preventive measures we are all doing. It's not a magic bullet, but it's one of the best tools we have in addition to the basic preventive measures of hand washing, of wearing a mask, and actually distancing yourself from other people. I think that message should go out to everybody on a repeated way, that COVID is still real in the Gambia. The best way to prevent yourself is to have the basic preventive measures I've mentioned, but also go and get the vaccine. That's the first message we should send to everybody here. The second message we should send to everybody is that if you want to be vaccinated, these are the places to go. The vaccines have been sent to all the regions. Vaccination points have been opened at all the health centers as far as we know. So most of them have opened today, the rest will open tomorrow. Those who are eligible, please go there and get vaccinated. I think these are the 2 simple messages we can all try to transmit out. The best way we can get our economy back, we can all start building our lives back again, is to get on top of this disease. If you get on top of this disease, we can all see life slowly returning back to what we call a little bit of normality. I think for me, these are the 2 messages we should all take from here. Otherwise, if you have questions, we should be able to respond to them as best as we can.
Preventing diseases, to have the vaccine, meaning to have the shot, I think it's one of the best and the most effective way of controlling this COVID-19. And he also emphasized that it's not the only way of preventing this thing. The continuous use of masks, hand washing, and also avoiding crowding. I think these are also important. We should also continue to utilize our health services at the health centers. I think that is also important. So these are very key. But from this meeting, we are also going to make a press release. So it's important that this message reach as many people as possible across the country. So we are trying to do our best. We just called him, and we have to commend him. He's very committed. We even expected to, Dr. Bide was expected to be here, but he is so busy, he couldn't make it. But we must thank our national coordinator for having time to be with us. We will also allow some questions, but what we can also add is to give you assurance that these vaccines are safe and effective. They are very safe. AstraZeneca is very safe. It's being used by many countries across the country. So that assurance is there. So far, since the launching on the 10th, all those who have got the jab, nobody has ever reported any problem. So that's an indication that it's very safe. I personally have the jab, and I have not felt even a headache. I haven't experienced any even fever. So I can say that it's very safe. So.
Even for me, I have taken it this month.
Okay, you've also taken it.
Any problem.
Yeah. And I would say many people, because even during the launching, we were even surprised the number of people who opted to take the vaccine. And you can also perhaps some already learned that the National Assembly members also requested for this thing, and most of them have already got it. Even you journalists, I understand that you are also requesting through the minister to have this. So let's give that assurance to the general population. But because of the stock level, our intention is to vaccinate nearly 60% of the whole population. But because we don't have that quantity yet, so that's why we are trying to prioritize. More vaccines will be available in due course. So we give you that assurance. From here, we can, my boss, you want to add?
No, they can ask any questions.
All right, we can entertain some questions.
My name is Ibrahim Ajalo from GRTS. My question will go to just what you have said, really issue of trust. A section of the population still don't trust of this vaccine. And, even though they have seen some vaccinated, some are still saying that it might not be the same dose or the same substance used on them. So do you have any plan in advance, before you start the activity properly, to make them or to convince them that this vaccine is safe? And in the event that some still don't comply, what are you going to do?
Okay, the first thing is I will answer the last question much quicker. I do not think there will be at any point where we will have to enforce acceptance of the vaccine. That's going to be contrary to everything we do in the health system. We don't force anybody on a health intervention. That's never going to happen. We're going to try to educate, we're going to try to inform, we're going to try to educate, we're going to try to inform, we're going to try to educate, we're going to try to inform. That's going to be the strategy. In terms of when we start proper, no, we've started proper. Yes, there's no good way to start proper now. We've started proper. All the regions have received their vaccines. All the regions are starting vaccination. It's just that they are prioritizing on these 3 groups for the time being, and we'll open up to the other groups as we move along. So we've started proper. In terms of the skeptics on how we convince them, I think we will put the information out there. That's one of the reasons why we agreed to this. Put the proper information out in the public domain. Repeat it there, because I think that's the best way to do it. The vaccines have been one of the best public health tools throughout our lives. Majority of the people in the room, almost everybody in this room, had received a vaccine before. Is there anybody here who has never been vaccinated? Yeah, from childhood up to now. The vaccines have become effective. There is not a perfect tool or a perfect medicine anywhere, but vaccines have been one of the most effective tools we have. So I think the strategy will be, we will put the truth out there into the public, we will inform, we will test, we will inform, we will follow all the rules required to get the approval of any vaccine that's coming in. And the approval stages will be stringently followed. They'll go through the international procedures of approval. They'll go through the WHO pre-qualification for approval before they come. The national authorities here will look at it and approve it. And so we will put the truth there into the public and inform and educate.
I would like to know if you guys does not have the targeted percentage of the people that you want to vaccinate, what will the ministry do? I think it is 20% that you are looking for right now. So if you don't have that targeted 20%, what will the ministry do?
Okay. Yeah.
Okay.
Yeah,
Okay. No, let's correct that, because this is why we need the correct information there. COVAX is providing 20% of the government population in terms of vaccine doses. It's not we who are targeting 20%. COVAX is giving us 20% of vaccine quantity in terms of doses as a first instance. We are also getting vaccines from CDC, MTN. We are getting vaccines from CDC, Africa CDC through the World Bank grant. We are getting vaccines from many sources. All are going to be standard, good vaccines that we are going to receive. We are targeting, hopefully, to vaccinate up to 60% of Gambians. If we don't get that 30%, we'll just keep going until we get to that 30%. Because it is critical for us to 60%. It's critical for us to go to that 60% to comply with the rest of the world who are all trying to vaccinate up to 60%, to begin to open their economies, to begin to open for travel, to begin to open for people to move around again and get some life of normalcy. So we will not stop because we couldn't get far. We will keep going as much as long to get that far. I hope that responds to you.
I think this is important for all of us. We are all suffocated, economically, socially, in all aspects of our life. That's why it is so important that we come and protect ourselves so that we get this disease out of our populations everywhere. When that is done, then we go on our normal lives. But as long as this disease is continuing to rampage, if few people are protected, we will be with the disease, and then it will, in the end, as you see, other complications are coming. We are talking about this now, all of a sudden there's Ebola around this end. We cannot handle that. No African country can handle Ebola outbreak and also this COVID together. It may affect all of us. So that's why it's important for all of us to fight and spread the information so that people understand. Once they understand, I mean, we are there. But once people, some of these wild rumors, they are dangerous. They are dangerous. From the history of immunization, anytime you have a lot of cases, people don't go for immunization, this disease will come down. And it affects everybody, every aspect of our life. Many children will die, and we all be affected. So as long as people start to come respond to the vaccine, you see this disease go down gradually. We are not seeing polio now. We are not seeing measles. How many of us lose a brother or a sister to measles? I am one. You know, two of my immediate brothers, they died of measles. But now we are not seeing them, thanks to this immunization. But when you have people come with these wild stories, and you ask them, they don't have any source. People will sit, calculate, and come up with these dangerous rumors that is affecting human society. I think those are things we should try to desist from. Thank you.
This prioritized group can report to the facilities mentioned here. It's not, and the other regions are also going to embark on this same strategy. Their teams will be deployed to their various health facilities, and the elderly as well as health workers and people with comorbidity can report to the nearest health facilities they may found themselves in. So I think this is important. But important, again, this assurance to say that the vaccine is very safe, I think that should be well emphasized for people to be convinced to take up the vaccine. The vaccination will be very, very helpful in addition to some of the measures we are correctly taking, the mask and the hand washing and others. So I think it's important that people come up with decision to take up vaccine.
Even those at home who can't move, if they are immobile, if they are above 65, if they need this vaccine, we will go out all our way to vaccinate anybody who is eligible. Nobody. Everybody is a priority. As long as we have the target group, everybody is a priority, and we will try to make all the efforts to ensure anybody who wants the vaccine gets access to it.
Deputy
Okay, and somebody else also have a question. Okay, sorry. Okay, then go ahead.
Okay,
Deputy Director, you said like it is divided to 10 groups.
3 groups.
Three groups.
Yes.
But with time, I think people are living in various areas, so I think it can be more like a groups to people will get access to it.
So.
Yes, yes,
So,
yes.
Yes, as these people are doing here, there is a regional education directorate in LRR, URR, CRR, North Bank East, that's Farafenni up to Palodi, and North Bank West from Kerawan up to Bara.
Okay.
They are all doing it there today.
Yeah.
What
Yes,
you're saying, like if
yes.
the regional office in Carnegie have trained and deployed their teams to the health facilities. So similarly, the regional office in Brikama and the ones in Baka, in Masakonko, Bansang, Base, Farafenni, and SL will similarly do the same thing. They will train their health workers, deploy them to the health facilities.
Okay.
So what we are saying, the same category of people in other regions will be provided with this vaccine. What we are saying, let them report to their respective areas where they have the nearest health facility. They will have the jab. Yes.
Okay, my question goes to the national coordinator. Okay, at what period of time do you plan to get the entire population vaccinated?
Well, on the current trajectory, we're looking from now towards the second half or the last quarter of the year, if possible, before you can think of getting up to 60%. But the earlier we get there, the better for everybody.
Okay. According to experts, they say 9 out of 10 Africans will have to wait until next year to get vaccinated. So I don't know how.
That's because the rollout traction is slow. I had that trajectory. The rollout traction is slow in most countries in Africa. By being slow, I mean the vaccine uptake is not as fast as it is. In Europe, in Britain and the UK, US, the uptake is much higher. But even there, I don't think most of them have even crossed 40% after 3-4 months. Besides Israel. So it's the uptake of the vaccine which is slowing it, rather than the offering of the vaccine. So we have to talk to people, we have to convince people to improve the uptake. You are right. At the current uptake rate, the chance of us crossing the 60% line of everybody, or 60-70% of Ghanaians getting access and receiving the vaccine 2 doses, doesn't look as good as it is, but that wouldn't stop us from making the ultimate effort to ensure we capture as many Ghanaians as possible.
Okay, thank you for that question. At the continental level, I don't know what Africans are doing to make sure that they improve, because according to statistics, they said like Africa, out of 1.3 billion population, we have only secured 300 million doses. So it means about 1 billion people will be left without doses at the moment, as of now. So I don't know. Maybe you guys are working towards maybe finding doses for all the other 1 billion population, but I think according to what they say presently, it's really scary, because out of the 1.3 billion Africans, only 300 million doses have been secured.
Okay, I wouldn't be able to talk about all Africans. I mean, I think that'll be difficult. I mean, in another role, I would have done that, but not today. Not today. Another role 2 years ago I would have, but not today. But talking solely on the Gambia, as Siddharth has said, we currently have secured through COVAX a minimum of 20% of Gambia's population to have access to vaccine. We've also secured funding to get another 1,020,000 doses through World Bank grant financing from the African CDC. We are receiving 15,000 doses also from the MTN. Okay. So put it together, we're looking at a vaccine accessibility for us before the end of the year of well over 1.5, 1.6 million Gambians. That's over 60% of Gambians. That we know. What the rest of Africa is doing, I wouldn't be able to talk to you on that. But for most Gambians, if you want the vaccine from now to the end of the year, the vaccine should be available for you to have access to it.
Thank you.
Thank you very much.
Sorry, just little one. Do you have a percentage of the effectiveness of
the efficacy?
Yes.
You mean the effectiveness? I don't know, but the efficacy of the vaccine. Yes, the AstraZeneca vaccine, the latest report we had is that after second dose, the efficacy goes up to about 70-75%. That may look strange to you, but that's almost the same efficacy level of measles for many years. Measles vaccine. Yes.
Thank you. Thank you. Yes, Auntie.
Okay. I learned that 2 doses are to be given.
Yeah.
What's the duration from the first dose and the second dose?
So I think
It's
8 weeks.
8 weeks. 2 months, yes.
2 months.
When you are vaccinated, you are given a card, and it is always.
Yes, I have the card.
Okay, that's right. Yeah.
Okay.
It's 8 weeks.
The same date.
Yeah, the same date.
After 8 weeks, you can go in for the second one. Any other patient? Thank you very much.
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu ngeen am problème ci seen skin ngeen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba laka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi di waxee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentey tamit si ay dàlla waaye man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skincare plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi taas kenn waratu fi am problème kanam kenn waratu fi am problème yu picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
love like fire bring my love like fire
Agada.
Mbijan aganyadi.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyinji.
Okay. Korsa.
Nsila ID soto.
Sa soto. Sorry. Agada.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka. Mbare ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbari ya bere. Birin koyna fo katon.
Bari si kodo kino katon nim fo bolong blabe to.
56 branches mola soto Gambia jam.
Ha?
Gambia kono ani Gambia e bantala bankol. Nko kodo kiya bere to. Kodo sifa fo falindiro fo nyaadi lafta même na kodi to poto nim kodi maraw. Jannom number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale le dadi mani domorol ni fana beteat. Gambia dawda yalo ngam fa kendol sotale je.
Wo moyo diat.
Apelen da
baraka. Ni wo ka ni lafta nyelen kendol e bina.
Yalo bukani la ko la baraka ba.
Yalo ndel chosano lo.
Baraka.
We live in a day and age where technology is creating a world without borders, filled with unlimited potential to improve the lives of the people around us. Innovarex Global Health ushers in a new way of leveling the playing field with increased access to quality healthcare services delivered at your doorstep. Our qualified professionals are equipped with state-of-the-art point-of-care testing technology to conduct tests such as kidney function, liver function, electrolyte tests, body composition, hemoglobin, A1C, and many more services with the highest efficiency in delivering results. The addition to our flagship Wellness on Wheels, more fondly known as WOW Delivery Service, brings the entire clinical experience full circle. IGH has remained committed to creating the future of healthcare delivery. Gone are the days of sending loved ones outside the country for basic medical services. Innovarex Global Health offers a new peace of mind and takes pride in delivering the quality of care we all deserve.
When we touch down, better broke down.
Gamtel G Fiber, now you can enjoy super fast internet in gigabytes. G Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see that.